Good afternoon, everyone. Welcome to our fifth Living with Dementia webinar series. My name is Gia, and I'll be your MC today. Thank you for taking the time to join us online. Today's event is organized by the Yeo Boon King My Science Center with the support from Emeritus Professor Hong Hai, Ren Hai Clinic, and Mind the Gap 2020, as well as other donors who supported My Science Center's missions to improve mental health and resilience across all ages. Kindly note that this event will be recorded for archivals and marketing purposes. NUS and our partners may use some of the images and videos in online and print publications. Towards the end, we will also be doing a Q&A with the speakers. So please click the Q&A button located at the bottom of your screen to submit your questions. Should you need any assistance, please use the chat functions and my colleague will be assisting you. Without further ado, I will pass the time to our chairman, Emeritus Professor Kwa Yi-hyuk. Prof. Kwa, please.
Thank you very much, Gia. It's a beautiful Thursday afternoon here in Singapore. It's wet, raining this morning, but it's wonderful because the past few days been pretty hot. I know that there are more than about 1,000 people registered for this webinar from friends as far as Australia, America, and also as far as China, Malaysia, Indonesia, Taiwan are listening in. So welcome to this webinar. And I'm thankful to Professor Hong Hai and also Mr. Bao Heng Tan for the donation for this webinar. Asia is on the rise, and also the first slide, I'm going to show you the whole of Asia. See that is, so you see the continental Asia is a huge place, including Russia and also part of Australia, about 70% of the world's population. And we also noticed that in the past few years, this is the UN report about the population aging in most countries and is at a very rapid pace, and was what is more worrying for many of the policy makers is the increasing number of people with dementia. It rises exponentially and higher for women, the pink one rather than the blue one, both are increasing at a high rate. And you see in terms of number of cases of dementia, this also from the global study that China, obviously in terms of numbers, but the increase over the next 30 years will be as high as almost 200%. Similarly in Singapore, you look at the numbers, it's almost about almost 300% increase. So the number is tremendous, and its implication not only on healthcare services, family care, but also on the economy of the country. So if you want to know more of the prevalence of dementia in various countries, the latest chapter, latest book or information is from a book written, edited by Professor Helen Tree from Hong Kong and Kenneth Schulman from Canada. Is on healthcare, mental health and illness of the elderly. It's in a series of books called Mental Health and Illness Worldwide with Professor Norman Torres and myself, who are the editors. And the chapter that often quoted is the chapter that I wrote with Rati Mahendran on epidemiology of mental disorders across the whole world. So you can get it from this particular book. So I think we'll carry on, and I will start off with from China first, and after China we move to Taiwan, and then back to Singapore and Professor Ted Ng from America. So let me first introduce to you Professor Lee Chun Bo. Professor Lee Chun Bo is an...
Thank you very much, Professor Kwa. It's my great honor to be here to share some knowledge on dementia in China. Now I share my screen. Today, I will use 20 minutes or so to introduce some information about dementia in China. I will talk from 4 aspects. The first about epidemiology and disease burden. As we know, dementia is a chronic and gradually declined in memory, thinking, and reasoning skill. Its symptoms depend on the stage of this disease. For example, in the early symptom include memory loss, difficulty in remembering, especially recent events, and some emotional symptoms, apathy, depression, anxiety, and so on. And the late stage will very difficult in the communication and working and activity of daily life. This picture is about the prevalence of Alzheimer's disease and other dementia in worldwide. This frame it's about the it's China. The prevalence of Alzheimer's disease and other dementia in the medium of the world wide. Now the population in China aged very huge. This map displayed the Alzheimer's disease and other dementia worldwide. According to China's 7th National Census in 2020, the number of people aged 60 and above and over 65 is about 26 million and 19 millions, accounting for the 18.7% of the population over 60 and over 65, about 13.5. And China's older people is growing faster, and the incidence, morbidity, and mortality of age-related disease are significant higher. The incidence and of Alzheimer's disease and other dementia continue to rise. Its social and economic burden is increasing, posing a very important major medical and social problem that threaten urban and rural residents in China. This is from the China Alzheimer's annual report. This is showed in 2019. The top 5 causes of death were cerebrovascular disease, ischemic heart disease, COPD, chronic obstructive pulmonary disease, and lung cancer. The 5th is Alzheimer's disease. It increased 5 and from the 20 years ago. This is the cause of death. And adjusted age, the disability adjusted life years also increased from the 27th to 15th. This showed the Alzheimer's disease is very important the medical issue in China. This is the Professor Jia published one paper in Last Public Health, showed the dementia epidemiology in China. From this slide, we can see the prevalence of dementia in China. At the age 60, from 60 to 70, 69, the prevalence gradually increased, and its prevalence in this age about 2.8, but in the over 90, it's about 28%, the 30% is over. And the people with MCI also very increased very critically. The total prevalence is about 6%. Mild cognitive impairment overall about 50.5%. But the diagnosis with low rate treatment and the public awareness need to improve. Among the risk factors, age is the most strongest factor, and they also showed some gender disparities, the cognitive impairment. The female over about 10% in the mild cognitive impairment. And some of the reason there are many explanations. One of the explanation is that the longer lifespan, limited formal education, hormone changes may be related to the and other biological aspects. But the wider prevalence of female is higher than the male. The second is about the family and the services in China. Like all the other countries, today's dementia care, the center from the patient and the caregivers from the primary care provider, specialist, social service, medication, caregiver support, all these interacted together and formatted different styles about today's dementia care. There are some investigation about what's the valuable services in supporting dementia care for patients and their families. The top three, we can see the referral to community support service and resources, training on how to care for someone with dementia, help managing behavior symptoms. In China, most of the patients, they are cared by the families. So the caregiver burden is a very important issue. The Chinese government gave some strategy and policies. In the Health China 2030 plan, the Chinese government has proposed to improve effective intervention for disease such as Alzheimer's disease, and improve the public awareness of the prevention and treatment of Alzheimer's disease. In some area, will increase pilot area, and the pilot area will increase to 80 by the 2 years ago. The second is about how to improve the long-term care insurance. In June 2016, the Ministry of Human Resources and Social Security of People's Republic of China issued guiding opinions on the pilot program of long-term care insurance, selected 15 cities to carry out this pilot project. In the end of June 2021, the total number of participants in each pilot city for long-term care insurance reached over 134 million, and the cumulative people received benefits reached 150 million. the resources allocation status for Alzheimer's disease and related other related dementia, at least from resource allocation for the patient institution, community-based and home-based resources allocation, resource allocation for government organization, volunteers, and self-organization. Especially for recent 10 years, the internet and AI-assisted technology support developed very quickly. In the family care and service, I think there are many aspects. For example, the home care, health home care, in-home medical and personal care service for patients, and the dementia educational program, educational family about the disease process and management strategy. In China, the many hospitals, they have the memory care clinic and memory care unit for the specialized living environment designed for individual for memory loss. Now in some cities, the behavioral therapy and very tailored personalized care plan are developed. But in fact, in China, the economic is very imbalanced. In the less developed area, the huge demand is also very big issue. The nutrition guidance. Now there are some evidence-based trials in China. For example, some kind of finger study. So we also have a Chinese finger project to explore multiple component intervention for prevent the dementia. The third aspect, I will talk a little about on the innovation studies or on the management and or prevention. This slide shows the difficulty and challenge patient face in the diagnosis and treatment. This is general, but in China, this is also very dominant, especially how to access the early in time or therapeutic plans, and some of the new medicine, or we call it new medicine, is very high cost in treatment. So all this is barriers to the availability of the medical care. The proportion for the most used medicine of Alzheimer's patients in China, about 10% they receive no any treatment, and most of the patients they receive the medication, for example, the donepezil, mimatin, and so on. And some of them receive no pharmacology treatment, for example, the physical interventions. And there are also some new medication, for example, GV971, GV971. There are some recent innovative studies. In the recent years, many therapeutic approaches have been investigated to explore the potential effect for patients with Alzheimer's disease and other dementia, including anti-A-beta therapy, Pol-based therapy, inflammation modulator, antioxidants, neuroprotective therapy, modulation of cerebral calcium homeostasis, and so on. Some traditional Chinese medicine also there are many trials on this field. This is a distribution. This is the last year's trial published in the journals. For example, most of the traditional Chinese medicine 10 trials, and neuromodulation therapy, for example, transcranial magnetic stimulation, TMS, or transcranial direct stimulation, electronic stimulation, DCS, and so on. There are also some registered trials in the Chinese trial registration platform. Most is neuromodulation therapies. And there are some new, there is only one newly approved therapy in China, which the sodium, which is sodium oligomate capsules. We call it it's GV 971 for patients with mild to moderate Alzheimer's disease. It's a mechanism about brain-gut answers, regulating the imbalance of intestinal flora and reducing neural inflammation. There are also monoclonal antibodies. This is a review on the timeline of A-beta immunotherapy. But in China, there is one antibody now in the phase 2 clinical trials. And there are also some new FDA approved this kind of medication. For example, Donanemab, Alzheimer's disease, and there are also aducanumab is also approved to be used for the Alzheimer's disease in China. First in the Hainan Boao Parent Zoo, but oral is still very in the limited stage because it's very high price and the explanation. It could so in the future, when after the more and more experience, I think maybe this is one direction. Another is very important neuromodulation is about therapy. Is invasive brain stimulation. For example, deep brain stimulation for some deep area in the brain, but in the how to say the pilot trials, there are some non-invasive brain stimulation such as RTMS, TDCS, and TACS, transcranial vagus nerve stimulation, TVNS. We just completed one trial about the TVNS for old people. We have found that it could improve the working memory within the short time. So it's but it's still in the how to say a research stage. Another is stem cell-based therapy. There are also some the very early trials. For example, where the nasal drip in moderate to severe early onset Alzheimer's disease. And another is the Chinese medicine. There are many trials on the Chinese traditional herbal medicines, and acupuncture also in the some clinic. But how to say it still need some further evidence for the routine treatment. Now, there are many cognitive training for the Alzheimer's disease or mild cognitive impairment. For example, the cognitive training, we have there are many rehabilitation institute. They use this kind of cognitive training for the patients. And in the community, many old people, for example, in Shanghai, they every evening they have some exercises. We call it square dancing. This kind of some kind of aerobic exercise and training and the social engagement together. There are also some trials showed it has some effects for the prevent cognitive decline. Because of time, I think in the future research, the no pharmaceutical intervention are very needed, but combined lifestyle, risk factors management, and community treatment are also very important. The last slide is what the and thank you very much. I think this picture showed achieve health longevity is very the goal for the medical and for the social and for individual. Thank you very much.
Thank you very much, Professor Lee Chumbo. Wonderful to know there's so many things are happening in China, and I'm very glad that all of you are very optimistic of the long journey, but there's something that you are looking forward to. Now we will now cross the straits to Taiwan, and we have a good friend, Professor Chong Mien Yun, who is a professor in Taiwan. He is originally from Malaysia and Ipoh, and then went to study in Taiwan and move on to London for his PhD in the Institute of Psychiatry, and is back in Taiwan as the professor there, and he's done a lot of work in dementia, in aging. And so it's all to you now, Professor Chong.
Thank you, Prof. Hua, for your kind introduction. And good afternoon to all our audiences. It's my great pleasure to give an introduction on the dementia on Taiwan, as I have been most of my time studying and also make the research with the population in Taiwan. Yeah, my points I will spread into these four aspects to tell about the demographic changes and the prevalence, and also mention about the service provisions, especially on the family care and services provided, and also some of the innovative studies in the past, and also some of the studies in the future. Well, to give an introduction of Taiwan, a small island country in East Asia, and about the prevalence recently that we have seen. And in the past, this is a population trend and its changes in the past 50 and the future 50 years. And you can see that the peak of the population is about 23.6 million, which is in the 2019. There's a few years ago. And now the population is going down. Why it is so? Because of the low birth rate. You can see that though the total fertility rate is going down year by year, and it is also a similar phenomenon across East Asia and also in Singapore. So with the low birth rate, but also with an increasing life expectancy rate, you can see the population of the aging is growing. So in the next 50 years, you can see there's a surge of the elderly population, while the degrees of the young population and also the working age population as well. So you can see the change of the population structure by these two charts. With the degrees of the young and the working population, there is a surge of the old population, the population of the age. It is just a matter of numerator and the denominator. And you can see with the increase of the population of the age, so the population structure change. And I think this phenomenon is also happening in most of the world as well. So you can see from 2018 to 2025, Taiwan is experiencing the age society, and I refer to this as the aging population. We call it age is over the age of 65 and over. And from 2025, you can see from an age society is going to a super age society, where the aging structures also change from the young old to the middle old and the old structure. You can see the proportion changes as well as the life expectancy and the medical care is going up. So as I have said, the trend of the elderly population is a worldwide phenomenon, and not only in the East Asia and in Singapore, but also from most of the developed countries. So you can see from here, I think starting from 2025, most of these developed countries has become a super age society country. And for the prevalence, the latest prevalence of dementia in Taiwan, it was undertaken in the past 3 years from 2020 to 2023. You can see that the overprevalence is about 8%. And like China, female is outnumbered than male. And also it is increased with age, with the increasing of age. So the super age, the OO, of course, have a higher prevalence than the middle O and also the young O. And if the trends go in this way, so the population of the dementia will go up as well. So this is a projected estimated of the prevalence of dementia and to the year and the next 50 years. And it is a serious problem, not only to the population changes, the structures, but also, as Prof. Kwai said, to the economy as well. So what type of dementia that we observe? Is more than half is Alzheimer's disease, but I have to bear in mind there is only about more than 20%, 1/5, are the vascular dementia. And according to the survey, half of them are in a degree of a mild cognitive impairment, and 1/5 are in the severe stages of the dementia. And with the behavior and psychological symptoms, more than 1/3 have depression and the negative symptoms that need medical attentions. Of course, others associated with disorientation and behavior problems and other anxiety disorders as well. So for the disability, you can see that if you compare for the age of over 65, those with dementia and non-dementia, of course, dementia has much further degree of the disability than the average of the aged people. So with the prevalence bear in mind, how are we going to serve this community? So I give two examples of one about the policy taken by the government, and also one by the public of the society for the care, for the family care and the services. Now, actually, before 1980s, there is no such attention on the senior citizens. And most of the dementic were taken care of by the medical institutions or by the long care institutions or taken by their family. Until 1980s, they have the Acts of Senior Citizens, and where they can also enjoy the free benefits of the medical insurance, where they cover most of these what we call the catastrophic or the serious illnesses, including dementia. And in the early 20s, a pilot program was adopted for the development of long-term care, and it comes followed by the 10-year program of long-term care in providing a lot of the services, supporting services, and also the human services to the development of the long-term care program, including dementia. But dementia was especially taken out from 2014, that is 10 years ago, to prioritize the care only for the people of dementia. And because it is a heavy burden to the family and also to the society as well. And in 2018, it has taken out into the plan, revised it into the more action plan taken for what we call the friendly environment of the dementia with the plan 2.0. And now we are under the 2.0 plan. And then this is the Prevention and Care Policy and Act Plan adopted since 2018. And you can go on the website to search on these details of the plan. And I'm not going to go into details about it. And the goal is that until 2020, they will reach about 50% of the family carers of the people can receive support and training, and more than 50% of the people with dementia are diagnosed and received appropriate services. And more than 5% of the populations have proper knowledge of dementia and is dementia friendly. So dementia friendly is the word and is the goal that in the future development as well. And by the year 2025, you will reach the goal. We call it Friendly Taiwan 777. That means most of the figure from 50% to 70%. And from the public awareness, it will be about 7%. This is a target. So until 2023, we can see what are the services provided by the government and the private. And here are the numbers of institutions or the company that provide all the services, including all the home care, community care, and the institutional care. And you can see that most of it, like the home, is given by the home care services, established mostly by the private company. And what about the human resources for these home care services? And today there are about more than 100,000 of various kinds of home care services, from the care attendant to the care proctor and a care manager and case manager as well. And this mainly provide for the home care services. And with the public and the society, you can see that there are many society coming up. The three main were the Dementia Care Association, which looks after many of the veterans and also the public as well. And the other is a national one called Taiwan Alzheimer's Disease Association. And more academic one is the Taiwan Dementia Society, which provide a range of services and support to the family and the public regarding from the information and the training and etc. And most of the up-to-date information, the public policies and the government adoptions and how do you get the benefits, etc. And the government set up two important hotline. One is called 1966, which is a broader for the long-term care. And the other one is specifically for dementia. And this is the free line code 0800-474-580. I mean, if you know about the Chinese homophonic pronunciation for this numeric number means 474. That means when you get dementic, 580, that means I help you, 我帮你. So using this kind of a number they can easily remember, and for the service, for the support of the family. And for the public, you have when you can call it and how you can call it and what kind of benefits you can receive from the government and what kind of resources that you can get from the public and the private. So, and lastly, I would like to mention about some of the researchers and in the past of the innovative studies of the management and also some of the prevention. And I skip a lot of the innovative biological researchers and also on the pharmaceutical researchers, because this is not a point. We are going to take more on the management and the prevention. In the early days, I focused on the genetic studies, on the biological factors like ApoE, which we have some of the publications, but we more focus on the care and the service provisions. Like these are the master students that are adopted and are looking after the care model and the rural-urban differences, because in Taiwan we still have the rural community, and what kind of services that they prefer, and what are the main problems, what are the hazards or the obstacles they are facing. So, and in the end, there's a great rural-urban differences, but there is also a similarity between the Chinese community, where they prefer home care than most of the institutional care. And for most of the academic researchers, we have we call it TDA, Taiwan Dementia Society, that help to present most of the up-to-date researchers annually, and they also held the annual meeting. Also conducted all the training courses for the professionals and the lay people, and also for those who acquired the healthcare. And these are some of the slides that annually they make the academic presentations. And also for international presentations as well, international meeting like this in the 2020 of the Asia Congress Against Dementia. And also the coming one this year, at a joint conference of the Taiwan, Korea, and Japan on the north of the East Asia, and talking about the fight for dementia. And lastly, I would like to say something about our future research on just based on my own thought about the prevention and some of the things that we can look into in the future. And first of all, it's a prevention that give you prevented from dementia. First of all, having a healthy aging, healthy lifestyle, and the government also introduced the annual free health screening for those who have age 65 and above, which is good. And this is some of the public educations about what you can do and what you cannot do, and what you must do and what you can do less and what you can do more. So you can get also with the help of the health promotion administrations as well. And to advocate a healthy aging, like most of the society in our East Asia have done, and to prevent the debility and also the handicap and growing with the health, with the age-friendly environment as well. And one of the interesting that I can observe from this culture and the rest of the Chinese community It's a prevention using a recreational activity. We call it mahjong in English, or mahjiang in Chinese, or mache or machiok in what we call in Taiwanese or in Hokkien. And my mother, who died at age of before her death at the age of 90, is a good mahjong player, and he can keep very good knowledge about mahjong. And when he is in on the table with four of his buddy, he can play so well and so happily. And I can observe that you have to use your mind to think and to comprehend all your knowledges of the mahjong into the table here. And with the interactions of your body, the four people, we usually call kaki. I mean, the kaki in Malaysia or in Singaporean, the Malay word kaki. And you interact so happily. You have the happy times. And in such prevent you, you also use a lot of mind to think of all the cards there. So I think it's a good exercise. Unfortunately, before my mother's death, because most of her body also passed away before her. So I know, and I learned that you want to make friends, don't make those old ones, make younger than you, so that, when you get older, you won't be so lonely because you still have younger friends to play mahjong with. And the other thing is the compression of morbidity, like what Professor Chong Lee have just mentioned, because like many of the vascular disease, it will cause you into the vascular dementia. So how are you going to compress all this morbidity, especially for the young old? And it's very important. Look at this figure. You can see that if you can predict the treat the early, the compress the morbidity, physical morbidity, and you will also have a prevention of a dementia in the future. And look at these figures, that what are the preference that the family need. So for most of it, you can see that they did not use whatever facilities that were provided, and more than 50%, slightly more than 50%, they only rely on the institutional care. Most of them, they also like to have home care, which is very important. I think it's also is the value of the family culture, the value of the family in Chinese history, Chinese culture. And lastly is the one that promoted and also encouraged by the government, is the feasibility study using the latest technology like AI, the robots, the smart technology, and if we are going to apply for such projects now, it's easy to get the grants at this moment. So there's a lot of support and encouragement from the government to make such a prevention. You can see some of this latest publication of the local publication as well. So for this, I have to end now. Just a summary, that a brief introductions, and the introductions about the reflections on the Taiwan, but it doesn't necessarily reflect to all. But at least you can see some of the changes in the Chinese community. And thank you very much for your attention.
Thank you very much, Professor Chong. And I'm glad you could make it to the webinar. Prof. Chong just recovered from a bout of hepatitis, but is still mentally very active and very sharp. Now, before we call in Professor Ted Ng from faraway Chicago, I would like to say a few words about his study. It was based on research done here in Singapore at Jurong, and it's called the Jurong Dementia Prevention Program. I'm saying this because there are a lot of questions coming in now about what about prevention, and this is very, very crucial because although there's a rising tide, can we do something? Can we do something to bring down this rising tide, to stem the tide, so to say? So that's what we thought of about 20 years ago, and In 2004, about 20 years ago, I was invited to give a lecture in the Department of Neurology at Harvard. And I told them there's a possibility because we have so much data from the Singapore memory clinic here at the National University Hospital that tells us that we can able to improve the quality of life of many dementia patients. And we realized that dementia 20 years ago, even now is associated with hypertension and diabetes. And we talk about diet, exercise, and we put them together after 8 years of planning. We started this program called the Jurong Dementia and Depression Study. And together with my colleague down there, Professor Goldie Gunn and a few others, we started a program, a 5-year follow-up study. And it was over at a shopping mall called the Jurong Point Shopping Mall. This is the first time in Asia that the research is done in a shopping mall because to invite people who are normal, almost normal, to the hospital, it will cost them a lot of money. So shopping mall, a place is given to us by Mr. Lee Soon Tek and his family. And we were given a grant to do the study. And there were people who are diagnosed with mild cognitive impairment, the pre-dementia phase. And the first thing we did was to tell them about to stabilize the hypertension, the diabetes, talk about their diet, falls prevention, and 4 activities on exercise, Tai Chi, mindfulness practice, music reminiscence, and art therapy. Mindfulness attracted a lot of attention when I presented this data at the World Congress in Vienna last year, because many people are very keen because mindfulness is something to them a bit more spiritual, with something which Asians are more familiar with. So what we did was, firstly, people asked, are there any studies done? Are there any randomized control study to be done? So even before we started off the 5 years, by the second year, the editor of Lancet suggested that it should be published in Lancet first. So in Lancet, and then we did a study on mindfulness at RCT, a randomized control study comparing mindfulness and also health education. Professor Ted Ng will tell you the results later on. We also do a study on choir singing, choral singing, probably the first study in the world in which we scan the brain of seniors, teaching them how to sing and then to present the songs in various concerts. And there's also something on art therapy, a study which was first started in New York, but in New York, they didn't do the brain scan study. In Singapore, we started a brain scan study and also a lot of other immunological study, which later on Ted Ng will tell you more about it. And then there's a study also on gardening called horticultural therapy. This is done by together with National Parks, a lady called Angela Sia, her PhD was published in Nature Scientific Report. And once again, the data will be presented later on by Professor Ted Ng. And after 5 years, we found that the depression rate falls from 9% to just 4%. And dementia, the government rate of dementia for people above 60 years old is 10%. This study, after 5 years, is only 3%. In Singapore today, we have about 1 million people above 60 years. So the government data of 10% means we have 100,000 cases of dementia. If this program is introduced, you can bring the prevalence rate down to just 3%, which means that 3% is only 30,000, still a big number. I want to emphasize to all of you that dementia or Alzheimer's disease is a syndrome. A syndrome means it's due to many causes. So it's impossible to have one drug to try and stop the dementia. It has the multi-pronged approach. So this study tells you that there are many things you can do to bring down the prevalence rate from a 10%, the government data, to this study of just 3%. Now, it is now in the community. There are more than 10 centers now. We have this program called Age Well Everyday program. So it's common amongst the various day centers in Singapore and also our friends in Indonesia, Malaysia, even China, in the Sichuan. They're very keen on this study. But I realized that very important to tell people how much do you save from all this program. So we have something on the health costs done about 20 years ago. We found that for those with mild dementia, the cost is about 280 Singapore dollars, about almost 150 US dollars, and it goes down to about moderate and then severe dementia. So the cost in 2016, which is about 8 years ago, has gone up. Now, if you were to monetize all the program, was done by the professor of economics from the National Nanyang Technological University, and this is the cost benefits. So you look at the dementia prevalence of the Ministry of Health, 10%, you have 100,000 cases. The Jurong study, 3%, 30,000 cases. Per patient cost is about $12,000. So if you multiply the 12,000 by the 70,000 people who can be prevented, the cost is almost $800 million. Now, Professor Houston Kwa, the health economist, told me that we only measure the direct costs, but we have forgotten about the indirect costs, the cost on the health, the caregivers, which is tremendous. And someone called Martin Knapp at in London told me once that if the direct cost is 1 million, the indirect cost is about 2 million. So this is tremendous because caregivers themselves are ill, they need help and all this, and we add them together. So prevention is always better than the cure. So all this in the book called The Colors of Aging, and I was thank all our friends here. And now we'll get down to Professor Ted Ng to tell us about the biological assessment of all the studies. Professor Ng, you're ready? We're going to play.
Thank you, Prof. Pa, for your introduction and the invitation to give this talk. I'm Ted Ng, currently an assistant professor at the Rush Institute for Healthy Aging, based in the Rush University Medical Center in the USA. And I did my PhD under Prof. Pa from 2014 to 2018. So today I'll be presenting some of these studies that I've conducted with Prof. Pa's team and Prof. Radhi's team here. And my talk has two main parts. So the first part is on biological markers, or in short, biomarkers. And the second part is on prevention program for dementia. So let's dive into biomarkers or biological markers. So what are biomarkers? So let me give you an example. How many of you have blood draw when visiting plumbing clinics and hospital? So many of us here may have seen something like a blood test report here, and this is not confidential because it's just a picture that I grabbed from the Google. So as you can see here, blood glucose here is a biomarker, and there's a certain value that this person has, and then there's a range that this biomarker is supposed to stay within, and beyond which the level can be abnormal. So for blood glucose, which is an indicator or biomarkers for diabetes, higher than a certain level, meaning that person has diabetes. So the same can be done for Alzheimer's disease as well, although we would use different biomarkers and different cutoff. So please don't be bothered by the details of the diagram that I'll be showing you throughout the slides, because I will be bringing you through them and guiding you and providing you the take-home message so that everybody would understand the slides. And you can see highlighted on the right-hand side, let me bring it on. So the right-hand side, you can see dementia here highlighted. Dementia is a medical condition the two previous speakers has talked about. And the take-home message for this slide is that there's a window period where the clinical symptoms of dementia, such as forgetfulness, are not evident yet, but they can be detected by biomarkers up to about 20 years prior to that. It's amazing, isn't it? So don't worry about the different colors of lines. They just indicate the different types of biomarkers that can be measured. And I'll give you a bird's eye view of that in the subsequent slides. So how do doctors diagnose or determine someone has dementia, or specifically in this case, Alzheimer's type dementia? So for many years, doctors stain the brain of deceased persons with certain chemicals to determine the presence of two Alzheimer's type biomarkers. And they are tau and also the amyloid, indicated by the two brackets highlighted here. So of course, this can only be done, by the brain scan after the person, died. So how do we do that when the person is alive? Because that is more important, right? So more recently, technological advancement and whatnot, brain scan has been developed to inject certain chemical into the bloodstream, which travel to the brain. And by using certain brain scan, you can determine these biomarkers, the same biomarkers, in real life patient before, they are dead and, have to slice their brain. And of course, apart from these two main biomarkers for Alzheimer's, there are also other not so established biomarkers that are not established for Alzheimer's, especially in a clinical setting. So as I was talking about the field advancement, right? So in the past 10 to 20 years, there have been a lot of advancement moving from getting the brain fluid from the spinal cord to getting blood draw to now even researchers considering getting saliva and even stool sample in order to determine these different Alzheimer's related biomarkers. So in the next few slides, I will give you some bird eye view of these different types of biomarkers from different samples. So you can see in these slides that in the past 10 years or so, I would say, there has been an explosion in investigation or research into blood-based biomarkers. So essentially, as I alluded to in a few slides before, that we can determine these biomarkers by simply having a blood draw and measuring them in the lab. So as the field progresses, especially these past 5 years or so, I would say these blood biomarkers from the initial validation to recently has been a lot of momentum to consider them to be incorporated in the healthcare setting, especially in the US. Because these biomarkers are almost as good as brain imaging and the brain fluid markers that I've shown you just now. So of course, just now I've also alluded to the not so well established, the more research-based clinical, not so clinical markers. So one of them is this one called the brain-derived neurotrophic factors, in short BDNF. So in one of the earlier studies that were conducted with Prof. Kwa's team, we have shown that these biomarkers, when we summarize the evidence across all the studies published across the globe, these biomarkers, BDNF, not only decreases with aging, but it also significantly decreases in patients with Alzheimer's compared to healthy control. So you might be wondering, why is that important, right? Because it's important in modulating or cognition and memory, and also promoting survival functions of brain cells. So this decreased level may partly contribute to memory issues. And these memory issues has been shown in animal models as well by manipulating this BDNF level. So switching gear a little bit, we'll talk about an interesting type of biomarker, the gut bacteria. So some of you might be wondering, why are we talking about gut bacteria here since we're talking about the brain, right? So gut bacteria is an important part of everybody. And some of you might have heard that there are bacteria residing in our body even when we're healthy. And in fact, 70 to 90% of our cells are actually bacteria. So specifically in the gut, these bacteria residing in us can communicate with our brain. And gut is thus also known as the second brain that we have. And for just one example, you might have heard of the saying, the butterflies in the stomach, right? So this is when the signals from the brain communicate with the gut, which resulted in these so-called butterflies. And of course, that's from the brain to the gut, right? But recently, there has been a lot of research showing that there's also a highway or the interaction from the gut to the brain as well, which is in the other direction. So I understand again that this is a complex diagram, but I will guide you through it and provide you the takeaway. And the take-home message here is that there's this highway, that a pathway that link the gut with the brain, and hence the bacteria, the biomarker can also travel to the brain and resulted in different things that can change in the brain, including the amyloid beta, tau that I mentioned just now, the two established one, but also other pathological changes, including increased inflammation in the brain and also the body, which ultimately all could lead to Alzheimer's and also memory impairment. So in another study, also first in the world study that Prof. Kwas and Prof. Radi's teams has conducted, we show that there is difference in gut bacteria population in stool sample from those that we recruited that have this preclinical condition called a mild cognitive impairment. So mild cognitive impairment, or in short MCI, they do not have any dementia, including Alzheimer's yet, but they are somewhere in between healthy and having dementia or Alzheimer's. So in this study, we've shown differences in gut bacteria population in the stool sample that we gather from these older adults, or we call the elderly. Again, this is a complex diagram, but the take-home message here is that we show that they are significantly different compared to those who do not have the condition. So we had these two groups of research participants and compare their biomarkers in the stool sample side by side. And another study or review study, I would say, similar to the other study on BDNF with the team at Duke and US, we conducted a study that summarized evidence across the world and showed similar findings as well that concur or agree with what we found with the Jurong elderly. So which is important in this sense is that if these biomarkers can identify at-risk individual, so what can we do about it? So in the next slides or the next section of the slide, I will talk about an intervention that Prof. and Prof. Rowdy has devised and led called mindfulness, or later on I will introduce to you the Singaporean version is called the Mindful Awareness Practice, in short MAP. So you might be wondering, what exactly is mindfulness? So mindfulness is defined as the awareness and non-judgmental focus of someone's attention in the present moment, not the past, not the future. And it was postulated that mindfulness can improve various psychiatric symptoms, and actually indeed has been shown, but not shown in MCI or preclinical dementia yet. That's why this study was conducted. And Prof. Kwa many years ago have also shown that for the population in Singapore, Chinese, mindfulness was acceptable and did not carry any stigma or mental illness. So in order to conduct this study, we have to come up with some sort of a scientific aim. And these scientific aims are really into two main categories: improving biomarkers and improving thinking and memory functions. So from a scientific viewpoint, an RCT is a randomized control trial which we recruit, in this case, 55 elderly with this MCI condition and divide them equally into two different groups and compare them side by side after they undergo the intervention, and to see the changes in the test score of the biomarkers and also the cognitive or thinking abilities. So mindful awareness practice, as I alluded to, a Singaporean version of mindfulness that is developed by the late Mr. Wisinto and his wife as well. And there are a variety of mindfulness practices here that we cover in MAP. And they include mindful breathing, mindful stretching, and visual model correlation tasks. And as I have also alluded to just now, in this kind of scientific study called RCT, we divide participants into two groups, right? So the first group undergo the mindfulness or the MAP sessions, whereas the other group undergo this so-called health education program, in which nurses, psychologists, and doctors give lectures on topics related to the general health of older adults, including those listed here. So after giving you the context of what we did, so how and also when we did it, right? And also, especially important, when did we collect the samples and also examine the test, thinking, and memory abilities. So this is the very comprehensive study flow. Again, do not worry, I will guide you through it. So at the start of the intervention, we have 3 months of a weekly intervention, 1 hour with the MAP group, and then followed by another 6 months of monthly intervention. And then you can see in the light blue bubble, there were 3 different so-called assessments, which are time point that we collected the blood draw, the saliva sample, and also perform neurocognitive tests on these older adults to test their memory and thinking. And next, I will show you the results, what we found after undergoing this intervention and process and collecting sample and tests. So first, I will show you the biomarker results. So inflammation, you might recall in one of my remarks earlier in the presentation, is that gut bacteria and also this amyloid tau can influence inflammation in the brain and body. So normally, older adults or elderly with dementia, Alzheimer's, and even MCI have increased level of inflammation biomarker in the body. And we show that compared to the control group, the MAP group indicated in the light blue line shows significantly decreased body inflammation indicated by these biomarker levels. And apart from inflammation, we also show the gut microbiome, a scientific term for the gut bacteria, which I have shared with you previously, is that the harmful gut bacteria also decrease following this MAP intervention. So switching gear a bit to the thinking and memory outcome, we have also tested the subjects or the participants' memory and thinking abilities as I've alluded to. And here I show you two different results. One is attention. You can see there's an improvement in attention ability in these older adults only in the mindfulness group. And not only that, the short-term memory also improved in the mindfulness group, and it lasted throughout the whole intervention period as well. So connecting these biomarkers and intervention, this will be one of my last slides. Currently based in the USA at Rush, specifically in the Chicago city, my plan for my research is to connect the biomarkers with the intervention. So the way to do that is that in a general population, there will be different people, different elderly with different risks, and with different risks, they have different levels of biomarkers. And by measuring biomarkers, we can identify a subgroup of them that would have high risk for developing MCI and dementia, including Alzheimer's in the future. And by identifying this subgroup, we can recruit them and bring them to undergo similar intervention that we have conducted back in Singapore, including mindfulness, and there are other RCT intervention programs on horticultural therapy as well. There have also been choral singing, art reminiscent therapy that both Klaus and Prof. Radi's teams has conducted and published extensively in the recent years. And I would like to, bring this intervention to the Western world and see, whether we can replicate these and extend the benefits over in the USA as well. And with that, I would like to end my presentation. I would like to acknowledge and also thank for the support of these people and center and department for these studies that I presented and also for my career so far. So Prof. Khan and Prof. Radi has been instrumental in the studies that I presented. Prof. Rajan is my current mentor and boss at Rush. And of course, my science center and the department are also instrumental in the success of these projects. And with that, I would like to thank you. And here's my email should you need to contact me.
Thank you very much, Professor Ted Ng. Someone is complaining that they can't see your face, that because of the technical glitch now, they can't show his face, but now you can see him now. He's far away in Chicago. And so thank you very much, the wonderful presentation. Some people ask about how, for example, in China, Professor Li Junbo or Prof. Strong in Taiwan, if someone has a memory problem, what is the pathway for treatment? Where do they go to? Do they see a GP? Do they see a psychiatrist, a geriatrician, a neurologist, or psychologist? What do they do in China, in Shanghai?
Thank you very much, Professor Cole. As a psychiatrist, in my routine work, we see the patient with cognitive impairment in the outpatient clinic. If the patient with psychiatric symptoms or very severe other severe symptoms, we will treat them in the hospital in the inpatient wards. And I see one query about the some question on the nursing home. So I have a very brief answer for reply. with how many how about the presence of the home-based resources carried by the family. I have one date. There are more than 90% of cognitive impairment patients in China currently choose home-based care, which is also the main future direction of dementia rehabilitation, because the how to say because the population is very huge and the economic is imbalance in China. So this is the mainstream recently. Thank you.
Prof. Lee, I want to stay on to the question. I'm going to move the question to Professor Chong. Professor Chong, in Taiwan, if someone has a memory problem, the pathway of care, whom does the person go to?
Yeah, before I answer your questions, I'd like to say hi and hello to Dr. Esther in Ipoh. You say regards to me. Yeah, answering to your questions. In Taiwan, it's a free access. You can go to any clinics or any hospital, but eventually they will refer you to the gerontology clinics or dementia clinics, either in the general hospital, in neurology department, or in psychiatry department. So the final diagnosis has to be made by the neurologist or the psychiatrist.
Okay, all right. Because in Singapore, we had a memory clinic and we have the psychiatrist, the geriatrician, the neurologist, psychologist together,
Yeah.
But now there seem to be a split. Everyone have their own clinic. So it's a bit confusing for people. So you often ask them to go to the GP first, the family doctor. The family doctor will decide where to send them to. But still, there's some issues in terms of whom they refer to. I'm very glad in China you have insurance, and so if someone has dementia, is it easy to get insurance in Taiwan?
Yeah, we have introduced the long-term care insurance, and also for those who are age 65, and most of all the illnesses are covered, and it is also mandatory and also free services for dementia and all the catastrophic illnesses. You receive a free treatment.
Okay. Yeah. We want to move on quickly because some people ask about caregiving. Professor Lee Chunbo, we know in China, young people will move from the rural countryside to the city. That affects the care of people with dementia in the countryside, And in Ipoh, all the young men like Professor Chong and Ted Ng, they leave Ipoh. So Ipoh, all the seniors, we are fortunate we have Professor Esther down there holding the fort. So how do people in China and rural area, or how the people you think in Ipoh would manage all the young people away from the country? Even in Singapore, a lot of young people leave Singapore, they go to Australia, So the Australian doctors are in a way quite fortunate. Many Australian psychiatrists are from Singapore and Malaysia. Yeah. So how do you manage it in China then?
Yes, this question is very good, and it's very realist. And there are three main types of existing patient institutions in rural area, including social welfare institution for older people, or the in the home. And for example, some if very severe the patient to nursing home, and some of them there is if they may accept older people with no how to say the no ability to work, no sources to live hold, and no one to support. If this kind of there is some kind of institution for this kind of old people, and the another one, if the children how to say not in live together for work and so on, and they will there are some how to say, the living centers in some area, but not how to say, not very not all covered. I think so. Most small towns have only one nursing home that only provide water and electricity, some meals, and that only provide simple living facilities. So dependent on the local economic levels. Yeah.
So thank you very much. I think, and also, so young people like Professor Ted Ng, he goes to the West, journey to the West. I'm sure he'll come back to the East where wisdom is. So, so Ted, do you think, I'll ask you a question about neuromodulation. Are they doing these studies in Chicago?
Yeah, so far, not that I know of, as particularly in Chicago, but definitely they are neurostimulation study across the world, including in the US, including I believe Professor Lee also have similar study, and I'm sure in Taiwan, Professor Chong also probably have some heard of some studies on neurostimulation. But so far, not that I have conducted, so that could be another research project for future considerations.
Someone asked about what is the rationale or explanation for using neuromodulation. Someone want to say anything? Anyone? Traditionally, we think that the treatment should be a drug because we're thinking about the neurotransmitters. Now the idea has moved on. It's not just the neurotransmitters, it's also the electrical impulses in the cells. That's where the neuromodulation comes in. M.Y. Chong, any idea of this?
Yeah, as far as I know, there are 3 or 4 teams in Taiwan are doing such research. And I think the results are not very promising at this age, as far as I know. But going to see more reports from them, then we can make a conclusion.
Right. And then China is moving very fast to AI. And so we hope maybe in the near future, we'll be hosting another Chinese researcher, give us some interesting ideas on what's happening there. So we have just about 5 minutes or 4 minutes left. I want to ask Professor Lee Chun-bo, any final words of encouragement for people listening in? There's so much bleakness, everything is grim, but we talked to you about the depression prevention program that is moving well. Any other things that you want to tell all our audience?
And about the AI and its potential implementation. For example, one colleague in Shanghai, he developed one recorder through the voice of the individual. It can be automatically analyzed and give some judgment. For example, potential cognitive impairment and normal. So it's now in some only in how to say, not in routine care, just in the research stage. I think in the future, combined voice and some EEG, brain, the MRI and some multimodal data together, maybe exactly to predict or for the diagnosis of this kind of early patients. Yeah.
So thank you. I think the AI is moving very fast in China. How about in the States, Professor Ted Ng? Are they in the right track?
Of course, AI has been, in every single sectors, right? So, to be honest, at least as far as in my group, my boss and, our groups related to aging and dementia group, we have not really capitalized on the full power of AI, I would say, because AI can do a lot more things that we can ever imagine, but we have not really expand on this realm yet. And definitely, I think there's a good opportunity, like what Prof. Lee has mentioned, that all this voice detection and whatnot, different digital biomarkers can be incorporated into AI to detect dementia in the early stage, and that could be one of the frontiers of dementia as well.
So you remember, Professor Ted Ng, that here in NUS, there's a Chinese professor, Bao, is this research on language itself, the way people speak itself, could detect very early dementia. And I've spoken to someone from China, they're using voice for diagnosis of depression. I think things are moving very fast. Professor Chong, any final words from you?
Yeah, as we have mentioned that aging is a universal phenomenon now and has a great impact on our population and health and also the economy. And I think early planning and prevention is vital. One of the key issues is that what we have discussed is the risk reductions that we always omitted. And I'm a psychiatric epidemiologist. I'm always looking at what are the risks, what are the risk reduction. And I think this seminar brings a very good insight to the developing world. And my message is simple: to be prepared. I mean, we have early than late, and then we can work together and to face this problem. And a lot of exchanges and what are the things that we can use and utilize, and no matter what it is, like AI, robots, and etc., all the new technology that we can share among us. And thank you for holding this seminar as well.
So thank you, three of you. So it's not that bleak. People think that dementia management or research is bleak, but things are moving well. But also a reminder that dementia is not illness like tuberculosis or malaria where you can treat you one tablet. It is a syndrome with a different approach. And if you remember, if your memory serves you well, Professor Chong mentioned that you should always keep people younger than you. And here I'm surrounded by four interesting people. They're all younger than me: Maureen, Gia, Sean, and Cindy. They're all in their early 30s and 40s. They're helping up in this webinar. The webinar just finished in about 2 hours or 1.5 hours, but it's taken them about 3 months to prepare. So I want to thank all of them and thank all our speakers, Professor Lee Chumbo, Professor Chong, and Professor Ng, and I hope Professor Ng will remember exactly what Professor Chong mentioned. He journeyed to the West, but he came back and found wisdom in the East. So thank you very much to all of you and a nice day. Thank you very much.
Thank you.
Thank you.
We come to the end of the webinar, so big thank you to our speakers today. We have the feedback form, so please take some moments to give us your feedback. Your feedback is really valuable to us. And if you are interested in the healing elements of nature, our upcoming workshops is the forest bathing and terrarium workshops. The informations are in the chat box. If you want to learn more, please follow us on Facebook at Mind Science Center. Thank you everyone and have a good day.